Thank you, Speaker. I rise today to express my deep concern with the ongoing disputes between the Minns Labor Government and New South Wales Health psychiatrists. As of 30 January 2025, it was reported that more than half of all staff psychiatrists in the Sydney Local Health District have resigned, leaving our local mental health departments and services under extreme pressure. Speaker, I'm calling on the New South Wales Government and New South Wales Health to act to address the resignation of specialist psychiatrists across the state. Over the past 2 years, we've seen growing pressures on our healthcare workers, including our nurses and midwives, who are also protesting today. Further disputes across our health sector will only be met with an increased strain on our hospitals. Our public hospital psychiatrists play a pivotal role in diagnosing, treating and rehabilitating some of the most vulnerable individuals in our community. According to an ABS study conducted between 2020 and 2022, more than 8.5 million Australians aged between 16 and 85 had experienced mental health symptoms at some point in their life. Whilst not all of these cases require the assistance of a specialist psychiatrist, 8% of those people in that same group had self-harmed at some point in their life, and over 16% had experienced suicidal thoughts. The Concord Centre for Mental Health at Concord Hospital in my community is one of the largest mental health specialist facilities in our state. That means it is one of the most detrimentally impacted by the mass resignation of psychiatrists. The ward consists of 173 psychiatric beds, which I understand is being staffed by less than a dozen part-time specialist psychiatrists following these resignations, and it's being boosted by some support from locums. I'm not going to stand here, Mr. Speaker, and say that this problem hasn't been developing for a number of years. I won't play tit for tat or petty politics. I'm just interested in a solution, because mental health is something I mentioned in my first speech to this place as being one of my priorities. I want this fixed, particularly for our young people and for families, so that patients can have the dignity and mental health treatment that they deserve. Over the past month, I've spoken to many in our community, including hospital staff, who've expressed their growing frustrations with the state of the healthcare system. I want to enter into the Hansard an excerpt from an email I received from a constituent. Dear Mr. Pasqua, I'm writing to express my deep concern regarding mass resignations of 203 staff specialist psychiatrists in New South Wales Health. As one of your constituents, I feel compelled to share my thoughts on this pressing issue, which I believe poses significant risks to mental health care, and specifically at Concord Hospital. I don't think I need to remind you that the New South Wales health system has been drained of public psychiatrists for decades due to pay disparities between New South Wales and other states, as well as significant demand for private psychiatrists. Psychiatry is inherently a specialty which deeply cares for the most vulnerable patients in the community, and public psychiatry has by far one of the hardest working conditions in medicine. These psychiatrists who have remained staff specialists throughout all these years represent the best of us, as they have sacrificed and invested their time and effort into building a system which cares and tries its best to treat as many in the community as they can. Speaker, we know that mental health takes its toll on patients, on families, on friends and on loved ones, and the effect of these psychiatrist resignations is being felt by all. I've written on multiple occasions to the Minister about this issue, particularly and including when I was first alerted to the issue by a local resident in June last year. We've heard that budget constraints are the reason behind failure to negotiate, yet following the resignations, New South Wales Health sought to hire temporary contractors to fill these roles. The ABC reports that almost 1/3 of psychiatrists who resigned were rehired as visiting medical officers. This decision is ultimately costing taxpayers and not addressing the underlying dispute and creating greater instability in our hospitals. I hope that it is not lost on this government that these psychiatrist resignations mean that real people's lives are affected. The psychiatrists who choose to work in the public system have done so often at a financial disadvantage because they believe in their vocation. I don't want to see them being forced to find a new job interstate, being forced to work as casual locums or without job security, or losing them to private psychiatry, which ultimately locks out our most vulnerable who can't afford the cost of private services. We need the government to resolve this so that our psychiatrists feel like they are valued for the important work that they do, because I believe politics is about people, and I want to give everyone the very best opportunity in life, and that includes those living with acute mental illness. Thank the House.